All right, I want to throw this out at the very beginning. Name must have a name posted or you will not be entered into the meeting. This will go from now until we discontinue the EOC briefings and monthly meetings. Today's October 19th, 2021. We'll go ahead and get started. Dr. Cope, if you're ready.
Great. Good morning. Thank you, Chief Bruner. Just pulling that up. All right. Good morning. Thank you, everyone, for being here. At this time, we've got 2 active cases of COVID that we're monitoring here in Neah Bay. In the last 2 weeks total, we've had 6 cases. And because that's such a small number, a relatively small number, I did not pull out the individual data on age groups and vaccinations because it'd be pretty easy to tell who's who. But happy to report only 6 cases in the last 2 weeks. That's a significant decline in our rate of new cases. We've had 123 cases total. We have just 1 household that is in quarantine, and that is that household with our 2 active cases in it, and 1 other individual who's in a household that's not tested positive. So just 1 household that we're monitoring now. As you can see here as well, there's just been a rapid decline. We're over halfway through the month of October and have had less than 1/3 of the cases that we had in the month of August, and certainly less than 1/6 of the cases that we had in September. So good. This is old vaccine data by now, but it's the most updated data that I have. So we have at least 81.6% of our population that's 12 and up is fully vaccinated. I am 100% sure that it's more than that now, which is great, but just wanted to include that data for anyone who's missed it historically. Column County is still considered high risk for sure. That number % positive is still quite high. However, it's way down from where it had been in the last month or so. So we like to see it, we need to see it below 2% to consider anything less than high risk. But that is still good. They're down to 8 current hospitalizations for COVID. No recent fatalities in the last week, which is good, of course. And then that rate per 100,000 in the last 14 days. Also, that number is high. I don't want to lose that perspective. The goal to get it less than high risk would be 75 cases per 100,000. So again, still quite high, but it is down. So we're heading in the right direction for sure. And this is just a graph that shows that. And Washington State is a little bit slower in their decline, which makes sense. They've peaked a little bit later than Column County did. And the United States as a whole is also declining in every category, which is great, except for testing, which is very good. So they're keeping up the testing. I kept in these slides from last week because there's still certainly some questions about the booster versus the 3rd dose. And still, I think with a lot of the close following of the meetings by CDC and FDA, it's hard to know when something's actually been approved yet. So really, there's no change in official approvals, but there's been a lot of talk about the boosters and 3rd doses. So a booster is a shot for people whose immune response may have weakened over time. Well, it's something that we're very used to is a tetanus booster shot. Our community's been doing that, ever since we've had tetanus boosters. And so that's a similar thing. Once we know that your immune response to the vaccine has weakened over time, then we administer boosters. A 3rd dose, even if it's the exact same amount as a booster, is technically used for people who don't have a strong enough response to the first 2 doses in the first place. So right now, Pfizer is the only vaccine that is approved as an emergency use authorization for a booster shot, and that is for specific individuals whose immune response may have weakened over time. The third dose for both Pfizer and Moderna is approved for those who are believed to have not had a strong enough response to those first 2 doses. Johnson & Johnson is not approved as a booster or a third dose. Mixing and matching of vaccines. Of course, this comes into play a lot for individuals who got Johnson & Johnson or Moderna or Pfizer and want a booster of the Pfizer. And what we're seeing, the study that's been done is that actually things are quite favorable for mixing and especially going from Johnson & Johnson to a Moderna booster. I just pulled this quote from one of the studies that the individuals who had received Johnson & Johnson single dose shot initially and then got a Moderna booster saw a huge rise in their level of antibodies versus getting an extra dose of Johnson & Johnson. It sounds like so far the CDC is not planning to recommend one vaccine against the other, and we'll just make the data available as clearly as possible so individuals can make those decisions. But it has been true for the majority of the pandemic that Moderna and Pfizer have surpassed Johnson & Johnson in terms of efficacy or just how well the vaccine works. And we have seen still that data has pulled out that Moderna has had a greater percentage of individuals who did not proceed with illness or severe illness or death compared to the other 2 vaccines. So we're still waiting on an official word on the Pfizer vaccine for ages 5 to 11. We are getting more information that it would be a smaller pediatric dose. And in fact, they're making them available to order so that as soon as Pfizer or FDA makes this decision on Pfizer, we will be able to access it. So we are busy on our end working to make sure that we have a supply of this smaller pediatric dose for our ages 5 to 11 here in Neah Bay. They did meet regarding the booster shots for Moderna and Johnson & Johnson. Update is that they were in support of it, but no official emergency use authorization has happened yet. And certainly we should know more by the end of the month about interchanging vaccines, like I just mentioned on the last slide. Today is our first day of our flu vaccine clinics. So please head on down to the community gym. We're open from 9 a.m. to 4 p.m. Certainly we'll help any stragglers, but try to get there before 4, please. It helps our staff a lot to have time to clean up and not have to stay late. They're pretty tired, but they're in good spirits and happy to help. We will certainly meet elders or individuals who can't get out of their car. We will certainly meet you in your car if we can. So that's today and then also next Tuesday. And then our evening flu vaccine clinics, we had to move tomorrow's because of the community meeting that's happening at the community gym. So that is now on Thursday, October 21st. And then next week we'll have another one on Wednesday, October 27th. And that's for individuals who can't come during the day. If you can come from 5 to 7 p.m. at the community gym. Our COVID testing is at the community hall on Mondays from 1 to 3. You can, if you believe you've been exposed or having COVID symptoms, certainly call 2233 at the clinic and we will get you in on the other days. And the things to prevent COVID illness at this point are all the same. So get vaccinated if you can, wear a mask, stay home if you're sick, and really monitoring your health. It's been the entirety of the pandemic. It's been common that the COVID symptoms are similar to colds and allergies, but just really paying attention to things that are out of the ordinary. And sometimes we've had patients who really thought that they were having allergy symptoms. In fact, it's pretty common, and then test positive for COVID. So trying to just be as attentive to your health as possible. Washing your hands, staying 6 feet away from others who don't live with you or aren't a part of your pod, or you don't know their vaccine status, and avoiding crowds and poorly ventilated spaces. So I'll review. And that's it for me.
All right. Well, thank you, Dr. Cope, for that update. Looks like there's 2 questions. One of them has been answered. The second one is, how do you know if you have a strong response to qualify for the 3rd dose?
Yeah, so that would be a conversation with your with your provider. The CDC makes recommendations for certain conditions that would qualify as having a weakened immune response or a predicted weakened immune response. And many of those conditions include cancer, HIV, treatment for cancer, treatment for any autoimmune diseases. But really, I would suggest reaching out to your primary care provider and talking to them directly about your health status. Some of our patients who have chronic diabetes, we're concerned about their immune response as well. So it should be a conversation with you and your primary care provider.
All right. Well, thank you, Dr. Coe. Appreciate the information. Patty, go ahead with your update, please.
Thank you. The only announcement I have is that tomorrow the Tribal Council will be hosting a community meeting, and that's in regard to the recent vaccination mandate, and that will be at the gym at 6 p.m. tomorrow.
All right. Well, thank you, Patty. For the Makah EOC report, I just want to give everybody a reminder, please slow down when you approach the checkpoint. Be prepared upon your return to give us the number of occupants of your vehicle. There's no need to disclose your travel locations, plans, anything like that. Just please be aware that there is people inside that booth and maybe outside of it. So we need to watch out for their safety. So slow down, please. You can still stop and talk to them, wave at them, do what you got to do before you leave the reservation. So thank you for that. Appreciate all your cooperation on it. Just outside of the COVID response, I just want to send out a reminder that 10/21 at 10/21, we will be participating in a great shakeout. So the school will be evacuating to higher ground. That will be a trek from the school to DOT. We anticipate that there will be congestion on Woodland Ave, DOT, and that will last about 30 to 45 minutes. So if we can avoid the traffic in the area, please pass it on to the rest of the community that we will have littles evacuating the school and heading up there. Some of the students, this is the first time they've ever participated. We will have law enforcement officers along the trail from the school to DOT, and the stick staff will be assisting at that area. Wanted to let everybody know that we are going to discontinue the weekly EOC briefings and move to a monthly model, but there is still weekly briefings held by Clallam County every Friday. We can send that notice out, but if you want to log on to Clallam County Emergency Management website, they do have it posted with the links. The Makah EOC is moving from a partially activated model into a monitoring status. So we will have monthly meetings and we will have a monthly briefing after we have our EOC monthly meetings. So just be prepared for that. We won't send out any links until that's decided on this Thursday. And I want to recommend to everybody, please sign up for the Regroup Emergency Notification System at stick.org. That's how we will be getting information out along with Makah.com and also mass emails. Please check back to the stick.org website for this public briefing and additional information. We are going to decide on when information will be posted on that website from now on, and we will put that out at the next public briefing. So thank you. Yes, Betsy, we will have people in the roadway for the evacuation drill. Don't see any other questions. So we will go ahead and close this briefing out. Thank you, everybody, for your attendance. We appreciate your participation and everything you guys have done. Please reach out to the Makah or Stick EOC staff if you have any questions. If anything comes up during this time, wanted to thank you all for everything you've done so far. We're not out of the woods. We're still dealing with this, and we will be for a while. We're just trying to lower the work on the EOC because it has been very taxing, and we appreciate everything you guys have done within the community. I wanted to thank you and thank you again. Thank you to the Makah Tribal Council. And please remember to take care of yourselves, your family, and your neighbors. And we will be talking with you soon. So thank you guys and have a great day.
Thank you.